So what exactly is the latest step in Ontario's reopening plans? The social circle, as the government's calling, also known as bubbling. The idea is to widen the number of people you can be in physical contact with outside of your immediate family. What might the risks of that, though, be? Joining us now, who else but medical columnist and family physician, Dr. Peter Lynn. Hi, Dr. Lynn. Great to see you.
Good to see you, Vashi.
As always. So help us understand the concept of a social circle. Are you on board with what the Ontario government announced today? I think a lot of people are very excited to hug their parents and grandparents.
Yeah, I think there is going to be a lot of excitement with this. And the idea is that initially it was just the bubble about the people that you lived with. So therefore, you knew exactly where they went and their exposure. And now they're saying that we can expand that out to include 10 people total inside that thing. But you have to remember, so let's say I'm inside your bubble. All the people that I'm around is counting inside that bubble. So let's say if I have a family of 4 people, then those 4 people will count because I'm exposed to those 4 people. And so I could be bringing viruses in that sense. So therefore, you have to count everybody that is in the home of the other person. And so now we have to pick and choose who we want to come in. I guess if it's grandparents and stuff like that, it might be very easy. But if you're talking about friends, how do you pick which friends will come in? And once you belong to one bubble, they don't want you to be, bubble hopping in that sense. So we don't want them to be in your bubble and then also sharing something else with other people because now you're exposed to those other folks. So it is going to be kind of a little awkward to try and figure out the bubbling system. But the concept is once you're inside that bubble, supposedly we're safe. And so therefore we don't need masks. We don't need, to be doing the physical distancing. So as if they lived in your own household. And so that's why they said there's responsibility. So therefore, if I'm part of your bubble, I have to make sure that if I'm with strangers, that I need to keep my distancing, washing my hands. If I can't maintain the distance, I need to have a mask on. So that way I don't accidentally bring the virus into the bubbles that I'm belonging to. And so that's the concept. If you're looking at 10 people outside, as you pointed out, it's still physical distancing. So if those people are not part of your bubble, then when you're with them, you still have to stay apart, mask and so on and so forth. And that way we make sure that we don't bring viruses into the bubble. And that's the important thing. Yeah. Now, in terms of hugging, if you have a grandparent or something like that, for the older people or people that have immune problems, they're saying pay special attention. And I don't know, I've been saying this to my elderly population. When the kids come and hug you, just hold your breath for 10 seconds so that you're not breathing in their viruses or whatever they might be bringing you. So that's just an extra thing that I've been telling people to do to have a little bit extra protection against all those lovely hugs that everybody's waiting for.
We sure are. I think the point that you make, someone's calling you, Dr. I think you need to get that, or are you okay? I think that the point you make about the way in which we conduct ourselves within the bubble is an important one. And I'm thinking, when you come home from, I work in a studio outside of my house, right? So when I come back, you had told us all this kind of stuff that we can do, and you're washing your hands, making sure your clothes are off before you give your kids or your husband a hug, that kind of thing. My guess is that extends, right? Like the idea is to picture it within the whole bubble.
Yes, exactly. So everybody's going to take their precautions to come across. So therefore, if somebody's visiting you and they're part of your bubble, I would like to see them wash their hands, put their clothes away and things like that. And I want to know that they haven't exposed themselves. So for example, let's say I went to one of those rallies, those protests, right? So then now I've exposed myself to a lot of people. So therefore, maybe I'm not going to come and visit you until I sort of get over that 2-week period. If somebody is very ill or elderly or their immune system, they just had cancer and they got chemotherapy or something like that, then I'm not going to visit them. So that's why they're saying that there's that responsibility as well. So once you're part of that bubble, you're now responsible to make sure that you don't bring the viruses in. So I think the bubble concept is good, but just be careful in terms of saying, okay, I'm free to do whatever I want. We do all have the responsibilities inside that bubble.
Yeah, it's not a carte blanche. Exactly. So the federal government today announced that they were going to start screening, temperature screening at airports. And the Prime Minister got a lot of questions because just at the beginning of May, Dr. Tam had said that's not effective. The most effective thing is that 14-day quarantine. I wanted to get your perspective on, first of all, the fever as a symptom of COVID-19. Are we still as sure as we were 3 months ago that it's one of the big ones? And also whether temperature screening is effective.
Yeah, so temperature screening is one tool, but it's not going to pick up everybody. So about 80-90% of the people that have active disease will have a fever. So therefore, that's one way to deter people from flying if they're starting to feel ill. In other words, if people start to feel ill, they shouldn't even be there. But the temperature measurement is just a way to say you are ill, so therefore I can stop you from flying. But the more concerning thing is that we're now understanding that the asymptomatic people, these are people that have no symptoms at all, can produce virus. And initially, we couldn't understand how that happens because not every single one develops the symptoms, because we used to call it pre-symptomatic. So the 2 days before you get symptoms, and then you're going to get symptoms, so then we know that you got sick, you can actually pass the virus. But now we're finding that there are people that make the virus but have no symptoms at all. And the reason for that is that this virus could go into your cells in your nose and then use your photocopy without destroying anything. So in other words, there are people like that where the virus can go in, use your photocopy, make copies of itself, and then not destroy the cells. And if it doesn't destroy the cells, you don't get a runny nose, you don't get a fever, you don't get anything. And so they're just a little factory that's producing viruses. And those are the people that we're most worried about sitting on the airplane next to you or coming into your bubble or hugging people or getting close because they don't look ill. And that was the one that you heard the World Health Organization sort of backtrack. You know, they said, well, asymptomatic people really don't cause a whole lot of transmission. And then they backtracked immediately the next day because the studies are now saying that that is a big chunk. Let's say up to 40% of the cases are in contact with these people. So that's why the temperature measurement will not pick up those people. And so therefore, we still have to wear masks and observe all that physical distancing. That's still the most reliable thing that we can do to make sure that the virus doesn't keep jumping to other people.
I still get a lot of questions from people watching towards you. And one that stuck out for me today, which I think sort of dovetails off what you just described, was a gentleman asking whether or not there is still, or is there, one real defining symptom of COVID-19?
Yeah, unfortunately not. So it's not fever, it's not cough. If you get that where you can't smell, that's a very good sign of it. But unfortunately, a person with no symptoms at all, there is no damage from the virus. And that's what we're understanding that's different between this and SARS-1, the original SARS. The original SARS, as soon as it makes photocopies of itself, it destroys the cell. So therefore, you get symptoms, you look ill, people stay away from you, or you're so sick that you end up in hospital. So that's why it infected people in the hospital setting, but it didn't infect all the people in the community. So that's why with SARS-1, we only had 8,000 some odd cases in the whole world. And we only had 770 people that died in the whole world. Whereas here, this thing can pass in people that don't have symptoms because it's learned how to make copies of itself without destroying the cells. And so that's why this argument about does it happen or not happen doesn't matter. It is happening right now. So that's why we still have to keep that distance so that the virus can't make it across. So if we can just follow the same simple rules, the 6 feet apart, the mask if you can't do the 6 feet apart, and just wash your hands before you touch your face, because that's how you're going to bring the virus up. And if we do those simple steps, then we can stop the virus from moving around. And because we're now opening up a whole lot of places, if somebody is visiting a small town, because that's the only place they can get a haircut, which is not recommended, but if you're going to go there, please do those simple 3 things and you won't pass the virus to other people.
Yeah, I guess I wanted to ask on the heels of Ontario now reopening so much of Ontario. There's a regional approach, of course, but a lot of the province, other than the GTA and some other places in the Southwest corridor, are opening today. What's the one, if you could identify one single thing that we should learn from the experience of other provinces, or we should sort of internalize because of the experience of other provinces, what would it be?
Yeah, it would be to do those 3 simple things. So if we can keep doing those 3 simple things, even if I go from Toronto out to a rural area, I'm not going to pass the virus to other people. Our biggest concern now is that certain areas are open. And that's why I think originally Premier Ford didn't want to do that, because I can travel to those regions and then I can bring the virus to those regions. And if you remember in China, when it was Wuhan and then everybody took off in the trains and everything else, that's really how the virus spread out again. So that's why during this opening up, let's just be very mindful. In other words, we have to be even more careful about the 6-foot distance and the mask and then the washing the hands, because if we do a good job here, then we don't have to go through a second wave that everybody keeps predicting. So in South Korea now, they've already had increasing cases again. In Japan, they've had increasing cases. India, they've now topped 11,000 as they were opening up their economy as well. So until we get 0 viruses in our country or in our province, we have to be careful that the virus could be sitting around in people that look well. And that's the most important thing, because if we got tricked in the beginning thinking that it was only people that were sick that could pass the virus, we now know that people that look well, not intentionally trying to pass the virus, but they can in fact infect other people. So let's just do those three simple things in everywhere we go as the economy is opening up.
Great advice as always. Thank you, Dr. Lin. Appreciate your time tonight.
Thanks, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.